Okay, I'm Audra. I'm your nurse today. It's been 7 days since your last pick change dressing, or your pick dressing change. So I have an order to change the dressing. We already verified your identity. We've provided for privacy. Do you have any allergies to adhesive tape or antiseptic?
No.
Okay. Perfect. I'm gonna wash my hands. My supplies are here. My wastebasket is here. All right. This is my sterile field. This is part of my sterile field. I'm gonna go ahead and just put my gloves right like this. I'm gonna put on my clean gloves. And I would apply the clamp to each lumen. And right now I'm looking at the site to see if there's any redness, any issues at all, and I don't see any issues. And I'm gonna remove the old bandage and throw it away. And ideally, I would not be hovering over my sterile field, but because I have limited space, that's what I have to do right now. I'm gonna do hand hygiene again. Okay, I'm gonna have to move this a little bit. Still part of my sterile field. I'm gonna move this over just so this is visible. And if my hands touch anywhere that's not on the sterile field, I would rewash them. But I already have my mask on. Okay. I would not want to touch anywhere. I wouldn't want to touch my skin with the inside of the glove. I mean, with the outside of the glove. I want to stay in sterility, which I'm trying to do as best I can. And I really would be trying to not touch my skin. The sterile glove. Okay, this would already be over here. I wouldn't be touching this. So I'm going to clean the area with an alcohol swab. I would start from the insertion site and go out. Allow that to dry. Then I would use the chlorhexidine swab for 30 seconds. Then I'd use the skin prep over the same area. Allow that to dry. And I should have asked my patient to turn away from the incision site. Please turn away from the dressing site. I should have done that at the very beginning because we don't want any germs, any bacteria to be on the central line site. I'm trying to make this line to be in the center. The catheter should be in the center. I'm trying to gracefully remove this. And at this point, we would measure the catheter to see how much is coming out of it. We would measure the catheter at this point. I'm trying to find my pen. I just had it. To label the dressing. Okay, so I put the date, time, and my initials. And then we're going to pretend this is an alcohol swab. Remove the cap. Vigorously scrub. To flush my line. And this is not a perfect fit, but I would instill the liquid and then aspirate, and I got a return of blood. So I would flush the remainder of the liquid over 1 minute. Okay, I would make sure that remove the bows and wash my hands and make sure that the patient is comfortable and the stabilization is already on the dressing area, so we don't need any stabilization here. All right, thank you.